Hello, everyone, and welcome to today's webinar, Achieving Launch Excellence, Creating a Foundation for Success, presented by CMK Select. I'm Joe Keenan, contributing editor to Fierce Markets, and I'll be moderating this webinar. Just a few technical notes before we begin. If you'd like to download the slide deck, please click the Resources List button at the bottom of your screen. The webcast is being streamed through your computer, so there is no dial-in number. For the best audio quality, please make sure your volume is up. You can find additional answers to some common technical issues located in the Help button at the bottom of your screen. This webinar is being recorded and will be available on demand within 24 hours after the event. We will follow the presentation with a Q&A session. Please submit your questions using the Q&A button on the left side of your screen, and you can do that throughout the presentation. Okay, I think we're ready to begin. First, I'd like to introduce Jennifer Walsh at CMK Select. Jennifer, please go ahead.
Thank you, Joe, for the introduction. As Joe mentioned, my name is Jennifer Walsh, and I'm part of the business development team here at CMK Select. Today, we're going to be speaking to you about achieving launch excellence. This is our marquee service, but before we get there, I'd like to introduce you to CMK Select and who we are. CMK Select is a boutique employment-based consulting firm who is made up of 100+ strategic thinkers who lead, execute, and achieve results for your projects. We are a certified New Jersey small business and WeBank certified. CMK has been working exclusively in the life science industry for over 12 years. CMK works within the commercial and medical space while supporting those areas through technology. We engage with our customers through strategic consulting, program and project management, and business operations solutions. Today, we'll be focusing on our launch excellence service. I do want to stress that no matter where you are in the product lifecycle, there's an opportunity to engage with CMK Select, either through workshops or assessments or full client engagements. We encourage client teams to gain consensus through launch preparedness workshops, including setting launch objectives, launch planning, and tactical execution. We specialize in pre- and post-launch assessments. No matter where you are in the process, we can help, including brand maximization and strategy setting after the product is launched. With over a decade of experience and 65+ launches under our belt, we've created a proven methodology that can be tailored to each launch exclusively. CMK has institutionalized those learnings we've gained over the years to establish a center of excellence around launch. All with the support of our industry and agency professionals, we bring real-world insights to each engagement. Pleasure to introduce you to our main speaker today, Bindal Tarakia. Bindal established and oversees our commercial division. He has personally worked on over 25 product launches domestically and globally. He has spent the last 20 years focusing on the pharmaceutical and healthcare industry. His experience includes multiple therapeutic areas, including oncology and general medicine. Now I'd like to hand over the presentation to Bindal.
Thank you, Jennifer. Hello, everyone, and thank you again for joining today's session. Today, we're going to discuss creating a strong foundation to achieve launch excellence. My goal is that each of you walk away with at least one actionable item from this webinar. So let's begin. Many of you may already know that one FDA-approved drug typically involves researching thousands of compounds over the course of 10 to 15 years. It can cost the company over $2 billion to get that approval if you take into consideration all the costs from the start of the drug discovery phase. With that much investment in time and capital, it is absolutely essential to have an excellent launch. But what is launch excellence? If you did a quick Google search, you would find that the word excellence is defined as the quality of being outstanding or extremely good. So for the purposes of today's session, when we apply the term excellence to product launches, we mean launches that exceed expectations, not just meet them. So before we dive into the nitty-gritty, I wanted to take a quick survey. In the last 8 years, what percentage of drug launches do you think did not meet expectations? Now, by expectations, we mean achieving peak sales forecasts. I'll give you some time to put in your answers now. It seems like most of you chose 65%. It's interesting. It's a little high, but actually, if you said 50%, you would have been correct. Half of all launches do not meet peak sales forecasts. Only around 30% of launches could be classified as excellent based on our definition. So what's even more concerning is, of those launches falling below forecast, half of them missed by more than 50%. That means there's a 25% chance that your product launch will completely miss the mark. Now, there are a variety of factors that one can point to as to why many launches fall below expectations. It could be due to poor strategy, high pricing, little to no access, overestimated forecasts. However, there is this one key element that we observed on all the launches that we do that is required on launches, but it's not always considered. It's what we like to call aligned execution. You can have the best marketing strategy, the best access strategy, the right price, and an achievable forecast, but if the execution from all cross-functional teams within your organization falls short, your sales could be severely impacted. So today we're going to focus on how you can put your product in the best position to deliver an excellent launch by providing the right foundation for aligned execution. Pharmaceutical product launches are the culmination of the drug development process. It has that critical mission of making a big impact at introduction while still ensuring long-term success of the drug. So if we're striving for excellence, we have to look across the entire life cycle of the product, all the way through loss of exclusivity. A McKinsey study from 2012 found that for 85% of pharmaceutical launches, the life cycle trajectory is set within the first 6 months of approval. Now, a little over 2 years ago, there was another global study that cut that time frame in half to 10 to 12 weeks. Regardless of what school of thought you follow, I think everyone can agree that there are many critical moments of the life cycle of a product. But the launch phase of a pharmaceutical launch is the pivotal moment. So today we're going to focus on ensuring that foundation is in place to set yourself up for success for that pivotal moment. So when you think about the word foundation, most people may think about a house. Instead of a house, I'd like to use the concept of icebergs. I'm not sure what you may know about icebergs, but typically only 1/9 of an iceberg is above water. Whatever you see is just the tip of everything that is underneath. When you apply this concept of an iceberg to any business, what's visible to the public is the profit and productivity of a company. However, this is always buoyed by the company's foundation, purpose, and priority. So all business people want profit and productivity, but what too many people fail to realize is that the best path to attaining them is through purpose-driven priority. I bring up this analogy about icebergs because it's applicable to the foundation for launch excellence. The things you do below water or pre-approval will drive your success above water or post-approval to all your stakeholders. When we work on product launches, we simplify the process in 3 phases. So first, we want to establish the product strategy and align on an overall launch plan. Next, we want to execute that launch plan as an aligned team. And finally, we want to implement what was developed during execution and quickly evaluate its success. What's established and executed pre-approval will set up the success post-approval. So let's get into a little more detail on each phase. So the first main phase to a solid foundation is to establish the product strategy and align on a cross-functional launch plan. As simple of a concept as this may appear, we have walked into many situations where a strategy was very broad and ambiguous, or launch plans didn't even align at all to the strategy. Without spending the time up front to do both of these elements well, what's visible to your stakeholders after approval will most likely result in a suboptimal launch. Now, there's 3 activities in this phase that will help build that solid foundation. They are understanding the stakeholder insights and the market opportunity to help build a value story, then taking that value story to shape the brand strategy and launch objectives, and finally aligning the cross-functional teams to those launch objectives and develop an overall launch plan. In order to develop value for your product, there's 7 fundamental questions that we think need to be answered. Now, I'm not going to read all 7. I'm just going to kind of focus on some of the key ones here. What patient populations will benefit from this product or solution? Which stakeholders influence treatment choices, access to products, and patient outcomes? What are their needs? And which are the right levers to convince stakeholders to use the brand? In order to answer all of these questions, the proper market research would need to be completed. But we think the most fundamental one being the patient journey. The patient journey is the essential information gathering step to understand patient needs and treatments from all key stakeholders in order to develop the strategy and define the value of the compound. Now, once that patient journey is completed, you'd want to develop a situational analysis and a market map. This would identify the ideal product positioning and provide a quantitative analysis for patient segments. And then finally, you can build that value story, which sets the future direction for that product with a value proposition, the product positioning, and a target label. So once you're able to answer the key questions to develop your value story, it can be used to build a strategy for your brand and its foundational strategic objectives. By that, we mean the goals that need to be achieved to make the launch successful. Everything begins with vision. Vision is the future potential of your product. It's where you want to go. It's not the actual plan, but it drives the direction of your plan. Your vision statement should be big and audacious. Once you've determined your vision, you need to figure out how to position your product at launch. This is much narrower in scope since your launch may be one of multiple indications for a particular compound. In the case of positioning, broader is really not better. The key is to focus in on who your product serves best and how you serve them best. Every time you get more specific in your marketing efforts, you get closer to having a roster of stakeholders who fit you perfectly. Focus on that instead of the masses by being specific with your message. An example of a vision and positioning statement for a pharmaceutical product has been depicted on the slide here. But a great example of a successful company outside of life sciences that has done both of these things very well is Amazon.com. If you remember, when Amazon first launched in 1995, they almost exclusively sold books. Their vision was to be the Earth's most customer-centric company where customers can find and discover anything they may want to buy online. This was big and audacious. But then they narrowed it down using the following positioning statement. For worldwide web users who enjoy books, Amazon.com is a retail bookseller that provides instant access to over 1.1 million books. Unlike traditional book retailers, Amazon.com provides a combination of extraordinary convenience, low prices, and comprehensive selection. If we go back to our example on the slide, to support the positioning statement, you have to have foundations or pillars of launch. Some organizations may call them strategic imperatives or strategic objectives. Some may call them the pillars of success. But for our purposes today, let's just call them launch objectives. Launch objectives are the foundation for your launch. When developing these objectives, you should try to make sure each one is mutually exclusive, but collectively, they should support the entire positioning statement. Also, you don't want to develop more than 3 to 5 objectives. Any more than that, and your launch would lose its focus. It's important to take the time to get the launch objectives correct. Based on our experience with multiple launches, we found the most effective way in developing the brand strategy and supporting launch objectives is to facilitate a workshop with representation from a few key functional areas, not just marketing. Developing launch objectives in this collaborative manner not only gives a variety of perspectives, but also alignment when executing on those objectives. Once the launch objectives are created, it's time to develop an overall launch plan that takes into consideration cross-functional teams across your organization. We call these teams work streams. Each work stream would have their own strategy of what they would be doing to make the launch successful. The key here is that their focus should align to the overall launch objectives we just discussed. The information to gather for each individual work stream when putting together a launch plan include things such as what the key initiative is that they'll be working on, along with the business objective for those initiatives and the budget required. The launch objectives that the initiatives rolls up into, the timing as to when the initiatives would be deployed, and any cross-functional dependencies required to make the initiatives a success. And most importantly, how will each workstream measure to ensure whether the initiatives are successful? Since this is about aligned execution, it's important to get all the workstreams moving in the same direction and understand dependencies across multiple workstreams. Again, based on all the launches we've led, we found that the best thing to do is bring all the workstreams together in a room and have a workshop-style session so all teams can understand what each stream is doing, how it relates back to their function, and the overall launch. Once this key information is captured for each workstream, we strongly advise to put it in some form of a project plan that's able to track these dependencies in time. Again, it's important to take the time to get the launch objectives and launch plan correct. It is a plan and things can change all the way through approval and through launch. But if you're able to get the plan to 80, 85%, that would be a big win. So once the foundational launch plan has been established, it's time to get more tactical and execute on that plan. Again, this may seem like a simple and straightforward concept, but human nature has brought upon the idea of procrastination. Believe it or not, the internet did not give rise to procrastination. People have struggled with habitual hesitation going back to ancient civilization. The best laid plans can be undermined by not executing in a timely and efficient manner. Thinking back to our iceberg concept, if you don't execute effectively, what's visible to your stakeholders after approval will most likely result in a suboptimal launch. 3 key initiatives in this phase of the launch include selecting the initiatives that will be focused on within a certain time block, facilitating cross-functional meetings to strengthen accountability, alignment, and transparency, and ensuring operational readiness at product approval. When most organizations plan, they plan on an annual basis. If you think about it, most organizations have annual budget cycles, annual performance reviews, annual sales meetings. Having goals to begin with is critical, but for many high performers, that year context can be a big barrier to them. The reason for this is there's just too much distance between setting and accomplishing goals. It's hard to see the finish line. Think about all the excitement there is at the end of a new year and start of a new one. You forget about the past year, the lack of progress, the failures, and you make new commitments. But by chunking your year into smaller pieces, you don't need to have a dozen goals. You can just focus on a couple. And you can leverage this focus by creating a specific plan of action for this limited goal set to drive massive results. When we work on product launches with our clients, we like to execute in 12-week blocks. So annually, we work through 4 12-week blocks with a week for planning in between each block. This is a concept called periodization, which is borrowed from the sports world, where athletes focus on a critical skill they want to develop over a similar length of time. 12 weeks is enough time to get something big done, but short enough that you still feel a sense of urgency and you can always see the finish line. So applying the 12-week block concept to launch, each cross-functional workstream would select the initiatives they will focus on over the next 12 weeks. These initiatives are already aligned to the objectives of the launch, which in turn is connected to the product's vision. Once initiatives are selected, the key is to try to break these down into smaller chunks, monthly, weekly, and sometimes even daily activities to build out their execution plan. Execution is critical. It's the single biggest measurable differentiator. When you plan like this, you know exactly what needs to be done, and you either do it or you don't. It's binary, yes or no. But perhaps the area of most importance is accountability. You can have the most detailed execution plan, but if no one is executing on it, the plan becomes meaningless. We feel accountability is the secret sauce to high performers and high-performing teams. An example of this comes from an old story cited from Fast Company, Change or Die. What if a trusted authority figure in your life told you that you needed to make a change in your life or you would die? What would your chances at success be? Now, your survival instinct is the strongest motivator known to man, but surprisingly, your chances are not that good. The scientifically studied odds are a 90% failure rate. There was another group in the study that had a much higher success rate, almost 7 times greater. These patients were in a peer support group, and they had a success rate of 80%, and it's all because of accountability. We don't like to go against the odds when we're talking about launching a new product to market. We would take an 80% success rate every day over a 90% failure rate. So hopefully this helps you start to take accountability seriously. So how do we ensure accountability? We feel the most effective way is through the implementation of regularly scheduled launch readiness meetings. I know there are many meetings you may participate in, and they may seem like a waste of time, but being that the execution is happening in 12-week blocks, your launch readiness meetings are hyper-focused. A typical meeting is facilitated by a launch lead and has 10 to 20 cross-functional work streams coming together to discuss what's been accomplished, what's upcoming, what's not going according to plan. This forum supports accountability and ensures a higher success rate in getting things done. This is also a forum to discuss risks and issues and develop mitigation strategies in case something arises that could negatively impact a successful launch. These meetings ensure alignment, collaboration, and effective communication so everyone is marching in lockstep towards launch objectives. Now, I mentioned the role of a launch lead to facilitate these meetings. This can be a brand lead, an operations manager, or more likely than not, a project manager who supports the brand. Whomever you select to lead these meetings, they should not have the role of being a workstream lead as well. It's critical that this person remain independent and objective and understand how the launch is going across all workstreams. The launch lead should formally track how each workstream is progressing against their execution plan, hold teams accountable, and most importantly, understand how the team is progressing overall towards the established launch objectives. Clients generally engage with us in this capacity due to our objectivity and deep understanding of managing launches. If there's one thing to take away from this webinar today, it's to conduct these launch readiness meetings to ensure accountability. So we've determined that the strategic launch objectives after the 7 questions. We ensured cross-functional work streams developed their high-level plan that aligned to those launch objectives. We discussed each cross-functional work stream coming up with a 12-week execution plan from their high-level plan. We talked about the team ensuring progress through the facilitation of launch readiness meetings. But how is the team progressing against the overall launch? How do we report back to our leadership? On our launches, we like to implement 6 readiness factors that provide a high-level status to all key stakeholders and senior management on how the launch is progressing. Marketplace readiness. Is the commercial marketplace prepared for the arrival of your product, and are you prepared to launch the brand? HCP and patient readiness. Are the medical and patient communities prepared for the arrival of your product? Supply chain readiness. Is your supply chain stocked with enough product for a successful launch and uptake based on the forecasted demand? Access readiness. Do a broad base of payers understand the benefits of your product, and are they prepared to reimburse the product at launch? Organization readiness. Has your organization made the necessary operational adjustments to add this product to the overall portfolio? And then finally, approval readiness. Have all the regulatory submissions been made, and have all approvals for launch been received? The initiatives that work streams are executing naturally roll up into these readiness factors. And how these work streams are actually progressing will allow the organization to know whether or not the product is ready for launch. We like to report on these factors in a dashboard format on a monthly basis to keep organizations apprised on how the overall launch is progressing and identify areas that may need some additional focus. So this brings us to our third and final phase, implement and evaluate. Your approval day has finally arrived, and all that hard work during the planning and executing phases comes down to this day forward. I mentioned at the beginning of this webinar about 2 studies that found that for 85% of launches, the trajectory is set as early as the first 10 to 12 weeks or as late as 6 months post-approval. Regardless of what timing you choose to follow, I think everyone can agree that this is a very limited amount of time to shape the product's life cycle for the next 5 to 10 years. So whatever we plan on implementing, we want to do it fast. Our focus in this phase is to operationalize that supply and demand change, deploy the launch tactics developed during execution, and then track progress of what was implemented against the metrics established when developing that initial launch plan. You may be familiar with the quote from the book of Mice and Men. The best laid plans of mice and men often go awry. Going through planning and execution phases, you may feel you're working towards implementing the right initiatives. Even your market testing can show the right messages are being utilized. However, just like that quote, things do not always go as planned. Since there is this limited amount of time to establish your product's trajectory, we implement what we call the fail faster philosophy. The basis of this philosophy is to quickly implement what was already developed. If we find that the initiative is not working in the field, we come back and try again by implementing a revised solution. We keep trying until we start seeing some success. The motto is, if you fail fast, you can succeed faster. You may be saying to yourself, that's a great concept, but how can we actually do that? So the first thing that needs to be done is to quickly implement the initiatives that you already developed during the execution phase. We do this with our clients through what we call an action plan. An action plan is a day-to-day, hour-by-hour plan of what happens for the first 2 weeks after the approval comes in. Everyone who is on this plan knows what they need to do when. So that gets implemented as soon as possible. In order to ensure accountability, we implement a quick daily meeting to review what was done and what needs to be done and where the issues are. Now, the key to having a strong action plan is to start building the plan prior to approval and challenge the status quo. By that, we mean don't just accept and do things the way they've always been done in the past, but press to find out why something can't be implemented sooner. Why can't the sales force begin selling on day one? Why can't a product be available shortly after approval? If you challenge the status quo and develop a creative yet compliant solution, you may be able to implement your initiatives much sooner. The second thing that needs to be done is to measure, monitor, and analyze how your launch initiatives are performing in the real world. We find that it's extremely helpful to collect this information in a dashboard so they can be analyzed collectively. But collecting and analyzing the metrics won't move the needle. We find that excellent launch teams continue to meet to review the metrics constantly so they can collaborate on solutions when things are not going as planned. You can either continue to have your regularly scheduled launch readiness meetings or have some type of war room set aside for impromptu meetings. The important concept here is to fail fast and then course correct to implement a revised solution. So here's some examples of key metrics or key performance indicators that can be tracked at launch and post-launch. Now, there are two types of metrics that can be tracked. They're what we call lagging indicators and leading indicators. Lagging indicators are metrics that track some form of outcome or result. Sales is a good example of a lagging indicator. The metrics that you may develop during the planning phase are most likely lagging indicators. Leading indicators are metrics that track some form of action that influence lagging indicators. The number of calls a rep makes to healthcare professionals is a good example of a leading indicator. To illustrate leading and lagging indicators in a more personal term, let's say I wanted to lose 20 pounds. The weight would be a lagging indicator. It's the outcome I'm looking for. However, in order to lose those 20 pounds, I need to track how often I go to the gym, the number of calories I eat, and the number of steps I walk per day. These are leading indicators. The more I go to the gym, the less amount of calories I eat, the more steps I take, will all positively influence my goal of losing 20 pounds. Successful launch teams measure and track leading indicators. It allows them to course correct quicker so that they can succeed quicker. I'm sure this was a lot of content to digest in the last 45 minutes. We went through the 3 phases of our launch process that demonstrated developing the value story, establishing launch objectives, creating a cross-functional launch plan that aligns to those launch objectives. We showed how to effectively execute the launch plan through the use of 12-week blocks and holding teams accountable. We provided readiness factors. You can report back to your senior management on how launch is progressing. And we demonstrated how to quickly implement your launch initiatives through the use of action plans and leading indicators so you can succeed quicker. We utilize the same methodology when we work on product launches, and we wanted to share some insights with you based on our experience. This first example is a launch we worked on in the dermatology space. They were third to market with strong competitors on the horizon. Using our methodology, we established the foundation for the product with strong launch objectives. More importantly, we aligned the cross-functional teams to those objectives and had them focus on initiatives that supported them. We were able to more than double the initial sales forecast and made the drug a blockbuster the following year. This next example is a launch we worked on in the oncology space. The product was second-line therapy with a breakthrough designation. Using our methodology, we determined during the execution phase that the product supply was not going to be available for at least 8 weeks after launch. We were able to identify the risk and quickly put together an action team to help mitigate that risk by streamlining the packaging process. The drug was available shortly after approval and was able to recognize an additional 5 weeks of revenue. Now, before we go into the Q&A portion of this webinar, I'd like to take this opportunity to thank everyone for listening. I hope that each and every one of you was able to take at least one actionable item from this webinar. Now I'd like to hand it back over to Jennifer to close out the session.
Thank you, Bindal. I'd like to point out several key results we've achieved for our clients. We exceeded the launch forecast by 20% within the first 2 months of launch. We also helped the client improve product output, resulting in 5 weeks of additional revenue. An important benefit of working with CMK Select is we give brand teams back 15 to 20 hours per week so they can focus on the strategic direction of the product. Please come and visit our website, cmkselect.com. Don't forget to download questions to keep in mind and our value story worksheet. Please complete the survey. This will help us to understand your thoughts of today's webinar. And if you have any questions or would like additional information, please contact me at jwalsh@cmk.com. And thank you. Have a great day. Now back to you, Joe, for Q&A.
All right, Jennifer, thank you. For the audience, we're going to go ahead and move on to Q&A. A reminder, there is still time to submit questions using the Q&A button at the bottom of your screen. We already have some great questions, so we'll try to get to as many as possible, given the time. So our first question up is, do you need to have all these cross-functional teams represented for a launch?
So thank you. That's a great, excellent question. The quick answer is no. What you need to have are, you need to focus on the cross-functional teams that pertain to your particular launch. So, you know, we may have shown 15 or 20 cross-functional teams. You may only need 5 or 10 of those teams in order to make your launch a success. However, what's really important is that you need to ensure that there is representation from each function that's going to impact the launch. So if you need 5 or 10 of those cross-functional teams for your particular launch, but you only have representation from 5 of those teams, you shouldn't disregard the other 5 teams, and you should figure out how, as a team, to cover those other 5 areas that may not be that may not have in your organization.
All right, Bindal, next question. Was there more you wanted to add on that, or are you ready for the next question?
No, I'm ready for the next question.
Okay. When do you usually start the launch process?
So typically, we start the launch process 18 to 24 months prior to approval. Now, that is an ideal situation, and you know, we've been in many situations where you weren't able to start till maybe 12 months or even 6 months prior to approval. It's important we still try to follow our methodology as best as we can. Obviously, the 18 to 24 month approval time frame is ideal, and you're able to do the appropriate research to answer those 7 questions that we discussed earlier during the webinar. But even if there is less time, you still want to see what are the key questions that could be answered. And we're still able to work with teams to at least launch the block and tackle tactics that need to be implemented for every single launch, regardless of what it is, such as the price or getting access. So quick answer or high-level answer, 18 to 24 months is ideal, but we have started launches as early as 3 months, but also or 6 to 12 months prior to approval.
Bindal, what is the number one obstacle? Yeah, what is the number one obstacle, either internal or external, you've encountered in preparing for a successful launch?
So the number one obstacle that we've seen is, I touched upon it, is accountability, but also it's working in silos and basically doing the same things that a previous launch may have done within an organization. You know, there are a lot of copycat launches out there, but what may be right for your launch may not be right for may have not been done on another launch, or vice versa. And working in silos is what we think is probably the #1 barrier, where people are not coming together cross-functionally to align on what's being done. So we sometimes see duplicative efforts. We see efforts that aren't aligned to strategic objectives. We see people not executing because there's no accountability.
Do you recommend pressure testing launch plans, and any suggestions on how to do that most effectively?
Absolutely. Pressure testing launch plans is great. I mean, at the beginning, in our first phase, we discussed putting this high-level plan together. That's an 80 or 85% plan. That launch plan is going to change or evolve as you're going through the process. You may learn new things. Maybe a new competitor just got an approval. But before launch, I would say maybe 3 to 6 months, you kind of want to have what we like to call launch readiness reviews, right? Now, we talked about those 6 readiness factors, but really figuring out 6 months prior to launch, prior to that approval coming in, how we're doing according to the readiness factors. Does it still make sense what we're doing, or do we need to course correct? And reviewing that with your senior management so the entire organization's aligned. Another time you'd want to do that is 3 months prior to launch. Things may have changed, or things may not be going as planned. You still need to get together, get alignment with senior management, so that when that approval does come in, people know and the organization, more importantly, knows what's going to be launched and what we expect the results to be. Next question.
Of all the product launches over the past 5 years, whether you worked on it or not, which do you consider most successful and why?
That's a very good question. I mean, I can talk to products that we've launched. That dermatology product, I do not want to. I unfortunately can't mention the name, but that launch was probably one of the most successful launches we worked, not only because we've doubled sales, but we've really brought a company that was not in the dermatology space and made them a serious player. They had multiple indications for that particular product, and even after that, they've still been exceeding their sales forecast, even after the organization knew the potential of this product, and made this a blockbuster drug after its first year in market. Unfortunately, I can't give away the name of that drug, but that was probably one of the most successful ones we've launched in the last 5 years.
Bindal, what do you recommend for how many months before you should start work for a new launch?
Again, I think ideally you want it 18 to 24 months before that approval comes in. That's the ideal case, but it can happen. As soon as possible is really the quick answer. Ideally 18 to 24 months, but if it needs to be 6 or 12 months, then so be it. But try to start with the basics and try to figure out what those objectives are. Those objectives may not be as broad if you only have 6 to 12 months, but try to figure out what you're going to focus on and focus on them and get the entire team aligned to that.
There's an audience question. What precautions would you take when launching a pharma medical device, for example, pain management device?
Well, I think even regardless of whether it's a device or a drug compound, I think it's any product. I think what precautions I would take in general is I look at everything from a supply and demand perspective, right? And any risk to that and making sure that there's no balance between the supply and demand is kind of the precautions I would take. So, for example, regardless of what the product is, whether it's a drug compound or device, I would want to ensure that there is product available at the onset once that approval comes in or shortly thereafter. I wouldn't want to wait a long time, because what you're trying to do prior to the approval is trying to build up the momentum and build up the market excitement of that product. And once that does come out, there's going to be demand for it. So again, I want to make sure that these things are more in equilibrium. Also, from a supply perspective, I don't want to overproduce something that's not going to meet the demands of the forecast. One other precaution I would also take is that there are many folks or many organizations that are quite zealous about their forecasts. They need to be realistic, and they need to really ground themselves. And by really answering those 7 questions, again, regardless of what the product is, if it's a device, if you're able to answer those 7 questions, you can really see what the true market is. I know this is easier said than done, but we've been into situations where that forecasts are just without any basis, just developed, and so that they're never going to meet their forecasts. Hopefully that answers your question. I think I'm getting the high side here.
We have, we're coming up on our last question, and then we'll find a lot of great questions today. Unfortunately, we don't have the time to get to them all, but we will be getting back to everyone who submitted personally after the webinar. So our last question is, what kind of training would you recommend in order to achieve the level of expertise needed to have accountability?
So I don't think there's any training I would recommend in terms of accountability. I think if there is training, it's really to facilitate productive meetings. I think the key thing is to bring everyone in the same room together and have a meaningful collaborative discussion. Again, there are a lot of meetings out there that do not have an agenda or purpose. So I wouldn't say it's really the action of bringing those folks together to make sure people are accountable. And getting that accountability really starts by aligning them right from the beginning, aligning them to what your vision is and what your objectives are. So again, if there was any training, I would say maybe it's more about making sure that people are, facilitating the meetings that hold people accountable. One way we do this, and this is just maybe more from a project management perspective, is that we know who's doing what, and we keep them and make sure that they're sticking to what they said they're going to do in a timeline. And now, again, it's a plan, and they may deviate from their timeline, but at least bringing it up and fostering an environment that they understand that, okay, I didn't get this done, it's okay, but now how do we address this? So, hope that answers your question.
All right. I'd like to thank the audience for attending this Fierce Markets webinar and submitting so many great questions. I'd also like to thank our speakers for participating and CMK Select for presenting today's webinar. Just a reminder to the audience, the webinar has been recorded, and you will be able to access the recording within 24 hours using the same audience link that was sent to you earlier. Thank you again for joining, and we look forward to seeing you at future events.